Hello, I'm Dr. Barnes here at Tiger Pediatrics. With all of us practicing social distancing, there's a lot of questions that parents have. Is it safe to come into Tiger Pediatrics for well visits? Is it safe to come in for sick appointments? Should everything be a telemedicine visit? And we want to try to clarify some of those types of questions. One thing is we're trying to be as safe as we possibly can to prevent the spread of any transmissible illness. So when you walk in the door, you'll notice that our receptionists and all of our nurses and all the doctors are wearing personal protective equipment, glasses and goggles and face masks for every patient encounter, including well visits. We clean and sanitize in between each patient that we see. And probably one of the biggest things that we have changed, and many of you might have noticed a change in the schedule, we probably had to call to schedule some appointments for those of you out there, is that well visits are only in the morning and sick visits are only in the afternoon. Some visits that are sick could happen in the morning, like an ankle injury or something like that, but in the afternoon is anyone who would have any symptoms that could in any way be considered respiratory, febrile illnesses, even ear checks tend to be in the afternoon. When it comes to well visits, it is important for children to stay up to date with their well appointments, especially those that have vaccines. If we fall behind on vaccine preventable illnesses, then we run the risk of having outbreaks like measles or whooping cough. And certainly the benefits of coming in and getting those well checked, where we're checking on the growth and development of especially young children, or providing vaccines that can prevent dangerous illnesses, the benefit of that outweighs the risks that would be involved in coming into a clinic, especially with the safeguards that have been put in place. Tiger Pediatrics is now using telemedicine for a lot of visits that we're able to do for sick visits. There are times when we do need to see that child in person, that we need to be able to listen to the lungs or look in the ears, or sometimes even feel a rash that you would think we could see on telemedicine. It's actually better sometimes for those to come in. But if you have any concerns at all, feel free to call and our nurses can walk you through whether the concerns that you have would be appropriate for a telemedicine visit, or if it'd be better to come into the clinic and be seen by a doctor. Tiger Pediatrics is here for our patients and our families during this difficult time, and that extends beyond just certainly physical concerns, but also we want to make sure that if you have any concerns about anxiety or depression or just dealing with the stress of the situation, feel free to call us and we'd like to help you and walk through that situation. If you have any concerns at all, feel free to call us, and we physicians and our staff are available to help. Thank you.